Our pets give us a lifetime of love,
Come on, Rusty.
so they deserve premium nutrition at every stage of their lives.
Good boy, Rusty. Good boy.
When you visit with your veterinarian in a few minutes, be sure to ask about IAMS Premium Protection. IAMS Premium Protection was developed by leading nutritionists and veterinarians to protect all of your pet's vital systems. Scientifically formulated with our most advanced ingredients, it has higher levels of quality protein to build muscle, an advanced fiber system including prebiotics for healthy digestion, optimally balanced levels of carbohydrates for vitality, and higher levels of vitamin E for a strong, healthy immune system. All high-quality ingredients to help maintain overall health,
Go get it, Rusty.
helping give your dog or cat years of healthy life.
Come on, Rusty. Come on. Good boy, Rusty. Good boy.
Ask your veterinarian about IAMS Premium Protection today. Specially formulated for every stage of your dog or cat's life, it's the most advanced IAMS nutrition ever for years of healthy life.
As challenging as it can often be to find the right food for your dog, finding the best food for your furry feline can be even more difficult. Cats are labeled as being finicky for good reason. They're often tough to please. One fact that does separate our furry felines from our canines is that cats, unlike dogs, are obligate carnivores. Simply said, they must have animal protein in their diets. Whereas dogs can thrive on a vegetarian diet, cats cannot. Also, cats need more protein than dogs, and their food often contains a bit more fat to keep it tasty. The bottom line, a dog can live on cat food, usually loving the extra richness, but a cat cannot live on dog food. So what should you feed your fabulous feline? Kittens should be fed kitten food, at least until 4 to 6 months of age, though some recommend up to a year of age. Kitten food, like puppy food, contains even higher levels of protein and nutrients for growth and development. After 6 months or so, a gradual switch to an appropriate adult food is recommended. What about brand? Can I buy food from the supermarket? The truth is there are many excellent foods on the market, and there is no one best food for all cats. For most individual cats, there are many good choices available, unless, of course, your cat is suffering from a medical condition which requires a special diet prescribed by your veterinarian. The basic criteria are as follows. Firstly, your cat should like the food. No matter how great a food is, if your cat won't eat it, it's worthless. The diet should leave your cat with lots of energy, a nice shiny coat, and firm stools. The food should also have an AAFCO certification on the label, which is the Association of American Feed Control Officials, preferably claiming the food has gone through feeding trials. Though most of the supermarket brand name foods may be less expensive than many of the premium brands, they also may not have the same caloric and nutrient efficiency provided by the high-quality ingredients in many of the premium brands. So you will probably have to feed more of this food to satisfy your cat's nutritional needs. It is always wise to compare the cost of a serving instead of the cost of a bag or a can. Having said this, if your cat is currently being fed a commercial name brand food, likes it, and is doing well, then don't switch unless your veterinarian advises you to based on a medical need. To help keep your kitties a little less finicky, you may, however, want to add a little variety and switch flavors every once in a while. What about canned versus dry food? Well, the jury is still out. Many have always encouraged dry food to help maintain healthy teeth, even though many cats seem to swallow even their dry food whole. Recently, some experts are advocating feeding cats more canned food, which has less carbohydrates than many dry diets. Why the sudden interest in cutting down kitty carbs? Well, we are seeing more and more diabetes in cats. Unlike dogs, who seem to develop type 1 or an insulin-dependent diabetes, much like our juvenile onset diabetes, cats are more prone to developing type 2 diabetes, much like our adult onset diabetes, which is more diet-related. The carbohydrate overload, possibly from certain dry food diets, may be predisposing certain cats to developing diabetes. Another diet-related problem we often have to deal with is a urinary tract problem called FLUTD, which stands for Feline Lower Urinary Tract Disease. Formerly known as FUS, this disease has many potential causes, one of which is, you guessed it, diet. We used to blame the overall ash content of a diet, which is simply the mineral composition, for the problem. Then we isolated the mineral to magnesium and were recommending diets low in magnesium. Now we better understand the problem to be the type of magnesium rather than the amount, and how it affects the pH or acid-base status of the urine. Most cats need a diet which leaves their urine slightly acidic. But what may work well for one cat may not do the job for another. More confusion. Lastly, obesity affects about 25% of cats. So selecting a diet which keeps your kitty lean is a must. If necessary, work with your veterinarian to find a low-calorie food to help keep your feline a little less plump. I know there's a lot to swallow here, pun intended, so if you need help finding the best fodder for your feline, check with your veterinarian.